Hello. My name is Monica Brinzak from the Department of Public Health, BBU Cluj-Napoca, Romania, and we are one of the Be Well project partners, and it will be my pleasure to be your trainer today. This training module will explore key communication skills that could support you and your team of health and care operators. It will focus on the importance of communication within healthcare teams, tips for effective communication within healthcare teams, a framework for resolving disagreement and conflict, the importance of communication within the team of health and care professionals. Effective and purposeful communication is a blend of listening, speaking, gathering and sharing information and resolving conflicts in a respectful manner that can help build trust and rapport with patients, community members, colleagues, and other professionals. A good communicator must take into account why they communicate, what is the purpose of communication, to give information to inform, who they communicate with, who are the people to communicate with, when they communicate, when does the communication take place, are there risks involved in the timing of communicating a concern or worry, what they communicate, what information will be communicated, is it necessary to check multiple sources, is the information presented in a way that is understandable to the audience, how they communicate, what communication strategy will they use, where they communicate, is the space created perceived as safe by the interlocutor if confidentiality and privacy are required? Is there a high risk that the interlocutor will not hear/understand it? Key health communication skills include active listening, oral and written communication and presentation skills, nonverbal communication skills, cultural awareness. Communication between healthcare sectors and between colleagues is necessary to ensure efficiency in healthcare. Interdepartmental communication ensures the seamless flow of information, reduces errors and maximizes patient outcomes. According to a 2023 survey, healthcare professionals cited delays in receiving information, technical problems, lack of incident response, and outdated technology as the biggest barriers to effective communication between healthcare sectors and among colleagues. Multiple studies and reviews suggest that poor communication in healthcare, both within the health and care team and between the health and care team and the patients, can result in poor comprehension, medication errors, and poor patient compliance, which can all risk a patient's safety. According to a recent study, more than 60% of all hospital adverse events they reviewed have been linked to poor communication. Communicating well with colleagues is certainly an essential prerequisite for successful team collaboration. Effective communication between healthcare professionals can help foster teamwork, boost confidence in decisions, and improve working relationships. Here are some of the reasons why communication is important in the healthcare field. 1. Patient safety. Patient safety is a very important reason for effective communication in healthcare. An effective communication based on transparency, clarity, and accuracy, together with compliance and trust between the professional and patient, can significantly improve patient safety. Such strategies are increasingly important in high-risk units such as the intensive care unit and the emergency department, but also in the case of health promotion and disease prevention. 2. Improved decision-making. Health and care operators can make better decisions when they are well-informed. Decision-making is a shared responsibility between patients and professionals, and comprehension is important for the best decisions to be made. To support with the decision-making process, it is important that health and care professionals in a multidisciplinary are able to share clinical data as needed in a timely fashion, in line with GDPR standards. 3. Improved job satisfaction. Communicating well with colleagues is certainly an essential prerequisite of successful team collaboration. Effective communication between health and care professionals can help foster teamwork, boost confidence in decisions, and improve working relationships. Studies have shown that communication between health and care workers is a major contributing factor to clinical effectiveness and job satisfaction. Poor communication about responsibilities and other inappropriate behaviors have been observed to negatively affect staff relationships, job satisfaction, and turnover. 1. A cohesive healthcare team requires effective communication characterized by trust, mutual respect, transparency, and collaboration. This encourages teamwork and promotes continuity and clarity to deliver the best health outcomes. 4. Improved patient satisfaction. Effective communication between health and care professionals can have an impact on patient treatment adherence, thus on the health outcomes. Due to poor communication, patients may receive conflicting information or incomplete information that leave them confused. Poor communication can have a negative impact on the patient's experience in navigating through health and care services. This could lead to patients receiving conflicting or incomplete information that could leave them feeling confused. Tips for effective communication within healthcare teams. For an effective communication within health and care teams, one should consider clear roles and responsibilities. In a team, it is very important to have a clear division of roles so that each member knows exactly what their responsibilities are. Open and transparent communication, followed by feedback, as part of your organizational culture. Team members need to communicate openly and honestly with each other, sharing information and concerns. Through constructive feedback, mechanisms, and transparency, health and care professionals can improve the way they work within and across teams. Effective listening. Communication should be carried out in conditions of mutual respect, taking into account differences in perspective and capitalizing on each member's positive contribution. Structured handover and effective information sharing. Structured handover should take place during shift changes or patient transfers, where essential patient information, lab results, diagnostic images, is transmitted promptly and accurately to ensure continuity of care. Collaboration systems. Facilitate efficient information sharing by adopting digital tools and systems for collaboration with other healthcare professionals. Open conversations, team meetings, and ward rounds are options that can encourage collaboration and communication. Here are some examples of particular situations in the healthcare settings when the strategies above can be applied. Morning briefings, shadowing another healthcare professional, multidisciplinary case reviews, patient handover. Here is a set of recommendations for developing a good environment for effective communication between the health and care operators. 1. Define communication methods and train staff. Please remember that there are various communication channels, and each has its advantages. For efficient communication, health and care organizations should define the methods that work best for them, and also define how and when each should be used. For instance, in the event of emergencies, emails may be ineffective, and if used may have serious consequences. Healthcare organizations should define how these methods should be used and train all staff on this. Cloud-based platforms and centralized data systems can be a bit complex, but are an excellent tool for sharing medical records across teams. Health and care professionals and administrative staff should be trained on how to use these tools in order to optimize them for patient safety and patient satisfaction. 2. Promote communication as part of the organizational culture. If communication and transparency are key essentials of the organizational culture, the work is halfway done. Health and care organizations should deliberately consider communication as part of their structure, operations, and practices. This also helps in building effective and successful teams, improves work relationships, and increases job satisfaction. 3. Create systems for collaboration. Creating opportunities for physicians and other healthcare professionals to collaborate can improve effective health and care communication. Whether formal or informal, these interactions can influence patient safety, the quality of health and care services provided, and most importantly, improve patients' health outcomes. Open conversations, in which all participants can share their concerns honestly and information transparently. Team briefings, collaborative ward rounds are some of the opportunities that can foster collaboration and communication. A major barrier to collaborative interactions of interdisciplinary units in health and care settings can be linked to a hierarchical internal structure. Studies show that hierarchical differences, role conflicts, worries about conflicts, and the complex network of relationships can impair effective communication in healthcare organizations too. Where such a hierarchy is imposed, there tends to be limited safe spaces for health personnel of lower rank to voice their concerns or share their ideas, oftentimes creating an environment that is not as collaborative. Solving these issues is important, and the health and care organization should identify ways to promote interdisciplinary collaboration across the board. 4. Review and assess the communication system and policies periodically. For continuous quality improvement of communication in health and care settings, there is a need to assess the current system and policies in place and upgrade and adjust as needed. Health and care teams should have the overarching goal in mind and continuously improve the methods and systems of communication. Periodic patient and staff surveys are an excellent way to get feedback on the communication efficiency and satisfaction of patients. The responses from such surveys can spark valuable insights and improve the current communication system in the health and care facility. In setting up effective communication systems, it is essential that health and care organizations assess the existing bottlenecks that can negatively affect communication and put measures in place to overcome them. 5. Use digital tools. In today's world, technology has the potential to make communication and collaboration easier, especially in cases where health and care settings are in harder-to-reach rural areas, or in situations where time is of essence, such as emergency situations. For example, centralized data systems that are accessible to the necessary professionals can save time and facilitate real-time interdisciplinary collaboration. Another example is the uptake of communication software such as Microsoft Teams, in which BeWell already has a course on, to encourage the wider availability of hybrid teleconferencing options between professionals and with patients. When introducing technologies, it is essential that the health and care organization implements accompanying training programs for professionals to 1. Learn about the digital tools, 2. Understand how to use it for communication, with the proper digital etiquette, 3. Apply safety considerations, in view of cybersecurity, data safety, etc. 6. Join a professional social network. Professional social networks are excellent informal platforms for collaborating with other professionals. On such networks, professionals can express themselves freely about their concerns, join interesting conversations, and learn about research findings from other colleagues. Social media platforms like LinkedIn and Twitter, now X, are great for meeting other professionals and joining conversations. While these social networking sites can be very helpful to professionals and patients alike, platforms specifically targeted towards specific professions can be even more beneficial. For example, physician-targeted networking platforms, physicians can connect with numerous medical professionals and ask other medical professionals about career advice, share and learn from each other's experiences. In addition, they can seek medical advice from other physicians about their own patients and have a more in-depth conversation. The importance of communication between health and care professionals cannot be overemphasized. While a common challenge for most organizations, when done right, it can significantly improve patient safety, patient satisfaction, and staff satisfaction. Resolving disagreement and conflict. The ability to resolve conflict or disagreement in the team is crucial to successful teamwork. This can be especially challenging for junior members of the team, such as students, or in teams that are highly hierarchical in nature. Here is a framework for resolving disagreement and conflict in teams of healthcare operators, developed by WHO for the Being an Effective Team Player course. You can pause the video and inspect the framework. As homework, please think about a situation at work where there was a conflict within your team involving you. What did you do to solve it? What would you do differently using the information in this module? Moreover, please think about one example of a patient handover that went well and another one that could have worked better. What was the role of communication in each of these situations? Now, for the reflection moment, think of a moment when you could not collaborate with a colleague. Why could you not collaborate? Is there anything you could have done to ensure the collaboration? Could you establish a mechanism for collaboration to facilitate it? Thank you, and we'll meet in our next lesson.